Hi, my name is Jenna Achord, and I will be presenting about a psychology research study that I did looking at whether self-esteem can mediate anxiety. So before we dive into everything, I just want to take a moment to start with a hypothetical scenario. When you go into a job interview, it is pretty common to feel anxious about a multitude of things, such as the possibility of saying the wrong thing and if you will be hired. According to Merton's self-fulfilling prophecy, having a preconceived expectation of what is going to happen impacts how an individual interprets the world, which manifests their expectation into reality. Anxiety about interview performance, when believed, can lead to behaving in a way that appears insecure or incompetent, which in turn reduces job interview performance. Considering the role that the self-fulfilling prophecy could play in increasing anxiety in such instances where an individual's expectations of their performance are negative, the question was raised in my head as to if there is a relationship between self-esteem and anxiety. Self-esteem and anxiety may impact performance in social settings such as job interviews. However, research suggests that there is an intricate connection between these two variables that I was curious to learn more about. There is limited discourse and empirical research on the relationship between anxiety and self-esteem and how nurturing one's self-esteem may aid in decreasing anxiety levels. My thought is that if individuals with anxiety were more aware of the power of nurturing their self-esteem to reduce anxiety levels, perhaps they could avoid falling victim to self-fulfilling prophecies. So, the goal of this study was to observe if there is a relationship between low self-esteem and high anxiety levels, because if this is the case, then that also means that high self-esteem would be related to lower anxiety levels. If there is a negative correlation between the two variables, where one variable increases as the other decreases, I was thinking that this could have implications for promoting positive self-esteem in and outside of therapy settings to help reduce anxiety levels. Growing up as someone with anxiety myself, I noticed that as my self-esteem increased, my anxiety had less control over my life. So I was curious to see what the science has to say as to if this is a measurable relationship and there is any accuracy to my own experience on a scientific level. So, as seen in the literature review that I conducted, I found that there is evidence that self-esteem is correlated with anxiety in previous studies. Data from another research study suggests that self-esteem can mediate anxiety and motion regulation. Additional evidence shows that low self-esteem is found to be associated with higher levels of social and testing anxiety, and in a sample of students from China, the ability and likelihood to be in a focused state of flow were linked to lower anxiety levels, which were found to be influenced by an individual's self-esteem. Flow being a state of mind where you're just completely focused into one topic or whatever you are working on in that moment. So, with that in mind, the current study predicts that self-esteem will show a moderately negative correlation with anxiety. This research was originally intended for a psychology class where each student was assigned to create their own research study. Each student enrolled in the class had to complete an extensive online questionnaire pertaining to different psychological concepts and disorders, and the data collected from the questionnaire was in turn used in each student's research paper based on the topics they chose. So, with that, we had 127 undergraduate psychology students within our sample, but out of those 127, only 125 of the participants responded to the questions regarding anxiety and self-esteem. The sample was consisting of 68.8% women, 24% men, 5.6% non-binary, and 1.6% other, with an age range of 18 to 34. As I mentioned earlier, all the participants completed an online survey consisting of a demographics questionnaire and a battery of 34 commonly used psychological measures, 2 of which were used in the study: anxiety and self-esteem. I measured anxiety with a Generalized Anxiety Disorder-7 Scale, and a question on that scale would look something like this. over the last 2 weeks, how often have you been bothered by the following problems? Feeling nervous, anxious, or on edge? And on the other hand, self-esteem was measured using the Rosenberg Self-Esteem Scale. A sample question for how that would look like on the questionnaire is rating on a scale how you agree with the following question. I feel that I am a person of worth, at least on an equal basis with others. Okay, so for the results, fortunately, they showed that my prediction was correct, and self-esteem has a moderately negative correlation with anxiety, meaning that as anxiety or self-esteem levels increase, the other decreases. As you can see on the scatter plot, when self-esteem levels are high, the anxiety levels are much lower, and vice versa. Low self-esteem levels, much higher anxiety levels. Items on the anxiety scale had a high internal consistency with scores ranging from 7 to 28, averaging at 17. Additionally, items on the self-esteem scale also had high internal consistency with scores ranging from 16 to 38 and an average of about 27.5. So a little bit higher than self-esteem, interestingly. And to conduct and calculate these results, we used a Pearson correlation test, and we found that the significant moderately negative relationship that I predicted was present. So what do these results mean? The goal of this study was to identify if there is a relationship between low self-esteem and heightened anxiety levels, and to observe if increased self-esteem may be able to aid in decreasing anxiety symptoms. The results indicate that there is indeed a significant relationship between low self-esteem and anxiety, and conversely, there is also a meaningful relationship involving high self-esteem and low anxiety levels, which is a moderate negative correlation. So, considering the apparent link between the variables and self-esteem's potential to mediate anxiety, these results propose that self-esteem has a moderate yet significant impact on heightened anxiety levels. From a practical standpoint, these findings underscore the importance of implementing interventions that target and enhance self-esteem in therapeutic practices. Such interventions may include cognitive behavioral techniques, self-affirmation exercises, and mindfulness strategies, all of which have the potential to not only alleviate low self-esteem and anxiety symptoms directly, but also to break the cycle of negative thought patterns that contribute to sustained anxiety. This suggests that incorporating self-esteem enhancement into mental health interventions may offer a comprehensive approach to managing and reducing anxiety among individuals with low self-esteem. So, the findings of this study align with prior research, reinforcing the recurring theme of a negative correlation between anxiety and self-esteem, identified in the literature review. Potential limitations include the sole use of self-report measures, limited diversity in the sample, a cross-sectional design, and differing measurement skills used across prior research, causing different contextualizations of anxiety. Future research should explore the relationship between the two variables through a study observing if practicing self-esteem enhancement decreases anxiety, because this would be directly observing what I was trying to explain in this study itself. Future research could also implement this through a combination of self-report and behavioral data, more diverse samples, not just using college students, especially psychology ones, more consistent measures of anxiety across research, and using a longitudinal study design. But ultimately, this research furthers our understanding of how self-esteem and anxiety are related and shows that there is importance in interventions targeting self-esteem enhancement to alleviate anxiety symptoms. Ultimately, I feel like this data is positive and demonstrates on a small scale just how impactful self-esteem can be on an individual's anxiety levels. Obviously, more research replicating this finding needs to be done to assure its accuracy. However, this research marks hope for those suffering with anxiety to implement self-esteem practices into their treatment plans. Thank you for listening to my presentation.